President Trump said he was not going to touch Social Security, Medicare, and Medicaid in the big, beautiful bill. But now that the bill has been signed, there is indication that millions are at risk of losing their Medicare and Medicaid benefits. So, what happened here? I'm going to dig in and let you know the category of people who are scheduled to lose their Medicare and Medicaid benefits because of this. And it's important that if you are in that category, that you take steps to prepare because millions are going to be impacted. I'm also going to clear up the confusion around no taxes on Social Security. Did the president completely eliminate taxes on Social Security? Well, if you dig further, there's only a percentage of seniors that can get that benefit. Others are going to continue to pay taxes on their Social Security benefits. I am going to walk you through that. And then finally, there is a new rule from the Social Security Administration that just came out yesterday that is going to restrict benefits for some recipients if they don't take specific actions by September the 30th. So there's a lot to cover today. I am Kwame Kwade, a government benefits expert. For 15 years, I've been helping seniors get the retirement benefits they deserve. If you are new here, welcome. I'm glad you're here. Do me a favor and go into the comment section and let me know your city and your state. And if you are returning, if you've been watching this channel for a while, I am really grateful for your support. Thank you for being here. So let's dig into it. There's a lot to cover. Let's start with Medicare and Medicaid. So the big, beautiful bill has restricted Medicare and Medicaid benefits for certain groups of people. So I'm going to walk you through that. So the first group that are really impacted is legal permanent residents. Now, this was not expected. A lot of the waste and fraud and abuse was targeted at illegal immigrants. Well, legal permanent residents, those who have green card and have permission to remain here in the United States, live and work in the United States and pay taxes, they are also now at risk. So only US citizens are eligible for Medicare going forward. Green card holders and other legal permanent residents lose their Medicare eligibility unless they become US citizens. So they have to go through the process of becoming a US citizen in order to keep their Medicare benefits. In addition, there is no more buy-in into Part A of Medicare. So legal permanent residents used to be able to buy into Part A. Now they can no longer purchase Part A if they do not qualify through their work history. It means that they have to have worked and earned credits in order to be able to get Medicare Part A. They cannot just buy into it. And then there is also extra help. Non-citizens are going to lose access to Medicare's extra help program that was targeted at low income beneficiaries. So that program also benefited legal non-citizen residents, people who are here legally, who are here working and paying taxes, and were able to access the extra help that is now not going to be available to them. This is going to impact millions of people because there is a big number of legal residents that were on Medicare that now are going to lose that access. Now, rural hospitals can now qualify for what they call the Rural Emergency Hospital Fund with expanded definitions and a lot of retroactive eligibility for facilities that were closed between 2014 and 2020. These hospitals receive monthly payouts and 5% outpatient payments to boost rural healthcare to keep them open. So there's something there for rural hospitals that is really good. So what does this mean? Well, most seniors who are US citizens will see no change in their Medicare eligibility, but non-citizens, permanent residents, and green card holders are at risk of losing their coverage. Now, Medicaid is where there's a lot of the pain that I want to talk about because even citizens are going to feel the impact. So let's talk about Medicare cuts. So the federal government is now restricting how much it is paying for the Medicare expansion group from 90% to 80%, shifting billions of dollars to the states. So for example, a state that has about maybe 250,000 enrollees, you know, are now going to be able to share that cost. And is their share of the cost is going to increase from like $200 million to $400 million per year. So what states are going to have to do is make a decision on what they are going to do to continue to cover those people. States now have the ability to tax healthcare providers, and that ability is phased out from 6% to 3.5% over years. And then one big thing is that able bodied adults now have to work at least 80 hours a month to get Medicaid. It used to be that if you are 54 and over, you did not have to work to get Medicaid. Now you have to be up to age 64 to continue to work to get Medicaid unless you are exempted. And those who are exempted are parents with children under age 15, those who are disabled, and elderly adults over age 64. Now, Medicaid and also Affordable Care Act subsidies that allowed you to be able to get health care on the exchange. If you're not getting healthcare through your employer and you're not on Medicaid, you were able to buy private insurance through the Affordable Care Exchange. Well, that has been strictly limited to citizens and a few groups of refugees and other legal non-citizens. So that program has been tightened dramatically. And then states that cover non-citizens or group that are no longer eligible now face penalties from the federal government. So the federal government is saying if you are going to cover non-citizens in your Medicaid program, you're going to face penalties and you're going to lose money that the federal government usually gives states to be able to pay for Medicaid. So they are cracking down on states being able to offer Medicaid coverage to non-citizens. And so that is something that is going to knock a lot of people off Medicaid. Now, one of the things that I think you should pay attention to is that they've also shortened the Affordable Care Act enrollment period. The annual enrollment window is now reduced to only 6 weeks from November 1st to December 15th, and is down from 8 weeks. It used to be 2 months, and now it's been reduced to 6 weeks. This is also aimed at knocking a lot of people off the program, because if you don't get the enrollment done within 6 weeks, then you lose your insurance. And then there's no automatic re-enrollment. So you must actively verify your eligibility every year, so that you can't just assume that once you have coverage that it automatically re-enrolls you from year to year. It will drop you if you don't verify your eligibility. And then there's no provisional premium eligibility. Applicants must complete all paperwork before receiving any premium subsidy. So there's no 90-day grace period where you used to be able to get premium while your paperwork went through. And then there is more redetermination. It means that requalification. So if you're on Medicaid and ACA or Affordable Care Act subsidies, you have to check your eligibility more often. Otherwise, your benefits will be dropped. And so if you put all of this together, what they are trying to do is frustrate you with paperwork, frustrate you with eligibility requirements, frustrate you with rules, new rules that you have to comply with. So essentially, if you are getting healthcare from the government, Medicaid specifically, you just have to pay attention to the rules. Otherwise, your benefits will be dropped and it will take 2 to 3 months to get it back. There is no grace period, or you don't get retroactive coverage if you lose your benefits. So essentially, what we will be doing going forward is making sure that we're creating guides and short guides for you that will give you the essential dates and rules that you need to follow in order to maintain your Medicaid coverage. And if you're on Medicare and Medicaid, that you are able to understand the rules that apply to your coverage. So that's the first thing I wanted to talk about today. The second thing has to do with the no tax on Social Security. Now, the president promised that there was not going to be any taxes on Social Security, that he was going to eliminate federal taxes on Social Security, and many retirees expected this promise to be fulfilled in the new tax law, the big, beautiful bill. Well, there's confusion around that, and there is disappointment because if you look at the headlines and official communication from the Social Security Administration recently, they are saying that Social Security benefits are now tax-free. Well, that is not correct. That is not accurate. Here is what happened. So the new law was passed under reconciliation, which is a process that allows the Senate to pass big budget bills with a simple majority. However, there's a rule called the Byrd Rule that prohibits any provision in the reconciliation bill that will increase the deficit beyond a 10-year window. And so this rule has been around since 1974 and forbids using reconciliation also to make changes to the Social Security program or including how benefits are being taxed. So there is a 1974 Budget Act that prohibits them from using reconciliation to touch Social Security. And so repealing Social Security taxes would have required the normal Senate process, which requires 60 votes. So they couldn't do that. So essentially, the new big beautiful bill does not directly repeal taxes on Social Security. Instead, they introduce a tax deduction, a 6,000 tax deduction that seniors can take on their federal taxes. So many retirees will pay no taxes on their federal, on their Social Security benefits for a few years, but it's not forever. It's only for 3 years. And this temporary deduction is not a permanent change. So it does not permanently change the tax code in order to allow Social Security benefits to be tax-free. So about 80 to 90% of seniors will pay no federal taxes on their Social Security benefit during this 3-year period, but this does not completely repeal. And it also applies to seniors who are age 65 and older. So if you are less than 65 and you are receiving Social Security and you're paying taxes, you are not covered under this tax deduction. So you will still have to pay taxes on your Social Security. And the law is also, while providing meaningful tax relief, does not cover all seniors. So I want to be clear that it does help some seniors, but it does not help all seniors. If you're 65 and younger and you pay taxes on your Social Security, you are not covered, and it's only going to be a temporary coverage for 3 years. Come 2028, we have to have this discussion again because Social Security taxes will be back at 100% of what you were taxed before. Now, so if you look at the headlines, you probably see some people saying that, there's a claim that Social Security is now tax-free. In reality, the law does not change the taxation on Social Security benefits directly. It only provided a deduction that temporarily shields seniors from paying taxes on those benefits. Now, the third thing I want to talk about is a new restriction from the Social Security Administration that was announced yesterday. Starting September the 30th, if you are currently receiving paper checks, if your Social Security check comes in the mail, you have to get a bank account and have your benefits directly deposited, or get a Direct Express debit card, which is a debit card specifically created for government benefits recipients who do not have bank accounts or cannot get a bank account to get their federal benefits deposited into their Direct Express card electronically. So essentially, if you are getting paper checks, you have to switch by September the 30th, which is about in a month and a half, or your benefits will not be sent. Now, there are a few categories of people that can get an exemption, but now the exemption process has been made harder. It used to be that the Social Security Administration or your local Social Security office could approve an exemption for you to continue to get paper checks. That has been eliminated. Now the Treasury Department is the only organization or the only government agency that can approve the exemptions, and there are very few people that can get exemptions to the rule. So if you're currently getting paper checks, you need to make a plan. And the three exemptions are people who have severe mental impairment preventing them from using electronic payments. If you live in a remote area without access to electronic payment infrastructure, or if you are not eligible for Direct Express card due to unique circumstances like card suspension. Those are the only three categories of people. And if you fall under those categories, then you have to fill out a form with the U.S. Treasury Department in order to get exempted. The only other group of people who are only going to get their Social Security check in the mail automatically are those who are 104 years old and above. So that is where the bar has been set. You have to be 104 years old plus in order to get paper checks. Otherwise, you have to be severely mentally impaired that prevents you from using electronic payment systems, or you live in a remote area where you cannot access electronic payment, which I don't know what that means, or you are ineligible for a Direct Express card. So if you need to apply for a waiver, you have to call 1-800-967-5042. That is the U.S. Treasury Electronic Payment Solutions Center, and then request a waiver. Otherwise, if you do nothing, your checks will stop. So that's what I wanted to present to you today. I hope it was helpful to you. If you found it helpful, hit the like button, hit the subscribe button, and I'll see you tomorrow in another video.